Hello, my name is Dr. Robert DeWars. I'm a neuropsychologist as well as a lecturer on psychiatry at Harvard Medical School. Many of the patients we evaluate present with multiple issues. In addition to oftentimes post-concussive syndrome, their lifelong history also reveals various degrees and types of post-traumatic stress disorder. The reason that we're talking today is to differentiate the conceptualization of PTSD from the United States perspective versus the European perspective. The Diagnostic and Statistical Manual, number 5 of the American Psychiatric Association, as well as the International Classification of Disorders, number 11 of the World Health Organization, both describe post-traumatic stress disorder involving 3 components: re-experiencing of the trauma in the present, avoidance of traumatic reminders, and thirdly, a persistent sense of threat that is manifested by increased arousal and hypervigilance. Both the ICD-11 and the DSM-V include these criteria as the basis of defining post-traumatic stress disorder. Additionally, the ICD-11 contains the diagnosis of complex post-traumatic stress disorder, which includes the 3 PTSD core symptoms just mentioned, in addition to 3 elements which are considered disturbances in self-organization. And those 3 criteria include affective dysregulation, negative self-concept, and disturbances in relationships. Treatment implications for the 2 different types of PTSD vary significantly, as well as the impact upon the concept of self. This differentiation, interestingly, was first discussed by Dr. Judith Herman of Cambridge, Massachusetts in 1992, who noted that ongoing and extensive interpersonal traumatic stressors, such as childhood abuse, domestic violence, or being a prisoner, negatively impacted self-organization independent of PTSD symptoms. The PTSD symptoms were something which oftentimes, but not always, developed in response to this type of emotional experience. Notably, when we talk here in the United States about the impact of multi-generational trauma, and sometimes the impact of multi-generational trauma, incarceration rather, sorry Peter, this can be understood as being related, as some cultural groups, particularly urban environments, oftentimes experience the frequent absence of adult figures with whom the child has become accustomed. And this absence, which results oftentimes from incarceration, sets the groundwork, sets the foundation for the later development of complex PTSD, as this absence, again, of the regular adult figure is thought to profoundly impact the evolving sense of self, the sense of security in the world, and profoundly impacts one's expectations of a social stability.